Welcome back to Therapy Thursday. This is stage 2 of our patellar tendinosis, patellar tendonitis series. Pete started with stage 1 last week where he showed isometric exercises to start loading the patellar tendon. That is, loading the tendon without movement. He showed this Spanish squat position, which allows you to get your center of gravity behind your knee and hold at various angles. And he showed sitting on a bench and extending the knee into an immovable object, both which initiate load through that patellar tendon. Both can work from an isometric perspective. I'd encourage you to watch that video because that is the starting point that leads us into the isotonic stage 2 of progressively loading the patellar tendon to get us back to sport and activity. Oftentimes patellar tendinosis, patellar tendonitis patients have gone to a bunch of other therapy. They've done a bunch of other things and they're still not getting better. This is a plan that requires some patience, and when we're doing an exercise plan, we have to start very basic and build up over a prolonged period of time. This isotonic phase is probably going to be the longest phase of these 3 stages, and so be patient. 8 to 12 weeks minimum would probably be a reasonable period of time. The reason we're focusing on this progressive tendon program is a recent RCT, randomized clinical trial, compared eccentric exercises, that is the negative phase of loading the patellar tendon only, with this more progressive loading approach. And this progressive loading approach is shown to give superior results both for getting people back to sport and also being more tolerable in the rehab plan. Less pain during the rehab itself, which improves compliance to the program. So I'm going to show you 2 positions to work this patellar tendon dynamically. That is through movement. And one's going to feed off the position of the Spanish squat that Pete used for the isometric exercises. So again, we're going to get ourselves set up into tension. This allows me to drop my body weight behind the knee, forcing load through the front of my knee, through the patellar tendon. To start, we're going to start with fairly slow tempo, nothing explosive, a 1 second down, 1 second up, and my arc of movement is pretty shallow. I'm not standing all the way up, and I'm also not going all the way down into full 90-degree flexion here. So to start, again, shallow movement, slow tempo, 4 sets, 15 reps. As you get better at this exercise, you can increase the range of motion, which is dropping further down and standing more upright, and adding some load. So putting more weight behind the knee is going to increase the load. As you add more weight, you'll have to drop the reps. So we start at 4 by 15, and you may end this isotonic stage around 4 by 6, 4 sets of 6 reps. That's one option, a Spanish squat position. Option 2, which might be more feasible for most people at home, if you have some dumbbell or some weights, is a split squat. Fairly vertical tibia, meaning it's a fairly upright tibia. My center of gravity is between my front foot and my back foot. Weight light at the side. Just hanging nice and comfortably at the side. Again, short arc movement, not all the way up into knee extension, not all the way down into knee flexion to start. Slow down, slow up, slow down, slow up. If you're doing this right, you should feel some tension develop at the front of the knee. Again, ways to make this harder. Deeper range, more weight. As you make this exercise harder, you're not going to be able to do 15 repetitions. You have to drop it down to something more like 4 by 6, 4 by 8. So that's where you'll finish up. This is stage 2. Stage 3 leads us into more plyometric, more explosive movements. That's going to prepare you for returning to sport. There are lots of other ways to do this, by the way. A leg press, a knee extension, are 2 ways that have been used in the research. We just try to give you an easy setup for an at-home gym. If you like this video, please subscribe, or any of our other content, please subscribe. And if you want to be aware of new video or content that come out, hit that bell at the top corner. See you next week, Therapy Thursday.